Hello and welcome to the Manchester Pride Conference 2020 in a slightly different format than planned, but we're still ploughing ahead and we've already had some brilliant conversations. And today our panel will look at LGBTQ plus health and wellness, which is always a pertinent topic, perhaps now more so than ever. So thank you for joining us. It's really been brilliant to see the amount of new digital engagement that people are participating in, and so we're excited to be part of that. My name's Greg Thorpe. I'm the project manager for Superbia at Manchester Pride, and I'm going to be hosting today, so hello. We have two brilliant panelists with us, and originally our conversation was going to be quite broad and was going to speak to the individual experiences and expertise of four panelists. People are struggling to make appointments at the minute, so we're really lucky to have two really strong panelists with us today who have very generously offered their time, so we're going to make the most of having them with us. So I guess to begin with, just for some opening comments, I mean, my background is in arts programming and curation, and I work, as well as working for Superbia, I write about art, I do mentoring with artists, I support artists to getting to access funding and opportunities, but really the basis of all of that is that creative expression is good for people, that it's good for people's mental health and their sense of belonging and the sense of themselves, and that's really what drives my creative engagement. And when we talk about kind of health and wellness in the LGBT plus community, we're talking about like the very general, so that is anything that affects the rest of the population also affects us, obviously, but then there's also the very specific, and that's things about aspects of health that might be specific to us, our lifestyles, our sexual practices, gender identities, things that really affect us uniquely and diversely within our population. So as I mentioned, this was going to be a conversation about many of those topics, but there's the elephant in the room that we're going to kind of include in our conversation, and actually it's really pertinent because social isolation is not a new thing for the LGBTQ plus community in lots of ways. And so the way that those things dovetail with health and wellness, I think, is a thing that we can talk about today. We don't want it to dominate the conversation, but it would be remiss of us to not touch on it. And we should say this isn't a space for expertise or for speculation. That's not our job, and there's enough of that out there, and we're hoping that everyone is getting the resources that they need for that. This is much more about health, wellness from the LGBTQ plus community perspective, and where we are coming from individually. So for those who don't know, Superbia is a programme of arts and culture for Manchester Pride. We operate all year round, and we curate and we support cultural events as a means of LGBTQ plus people coming together. And that's partly to do with coming together in healthier ways that don't involve kind of drugs and alcohol. So sober social provision, creative social provision, that kind of thing. So that's my area of interest and expertise. So I'd like to invite our panelists to kind of talk about themselves and their project and their interest in health and well-being. Can I ask Lou if you'd like to go first?
Hiya. So I'm Lou Englefield, and I'm a director of an organisation called Pride Sports. We're a Manchester-based organisation, although I'm speaking to you today from rural mid Wales. So talking about isolation, I'm about 8 miles from the nearest shop. And Pride Sports has existed since about 2006. We're an organisation that focuses on sport and physical activity for LGBTIQ plus people. We work to increase access to sport and physical activity for LGBTIQ plus people, and to tackle LGBTIQ plus phobia in sport and physical activity as well. So we work on a range of different levels. On some levels, we work to support the LGBTIQ plus sports infrastructure in England specifically. We also work at a strategic level with partners like Sport England, some of the national governing bodies, to make sure that sport is an inclusive, well, sport and physical activity are inclusive environments that welcome people from all segments of our community.
Brilliant. What an exciting project, and beautifully summarised. Thanks, Lou. Neil, would you like to introduce yourself and tell us a bit about who you are and what you do?
Sure. So I'm Neil Chaudhary. I'm a doctor within the Greater Manchester area. I work in A&E, and I've been doing that for the last 2.5 years in Greater Manchester. I recently also spoke at the last Manchester Pride Vigil, where I talked about my status as a HIV positive man living in Manchester. And I'm also part of a group called the Sunday Boys, which is a Manchester singing group for male voices, essentially, and mostly are made of gay men. And that's essentially the that's the sort of the section that I'm sort of representing today.
Great, thanks, Neil. So Lou, I'm going to come back to you with some questions about kind of sports and physical activity and our community, because I think we all maybe carry certain stereotypes. We are forced to carry them in some ways about, you know, gay and bi men being super gym fit and motivated, and sporty lesbians, you know, that we all idolized at school, if you were me. And but actually the reality is that in our community we're quite often not looking after ourselves in the ways that we could. And the LGBT Foundation did surveys which included this kind of data and found that 55% of gay, bisexual and transgender men are not active enough to maintain good health, compared to 33% of men in the general population. That's just one statistic, which I found really surprising and quite disparate to my understanding of, how I perceived the community in lots of ways. Can you talk a little bit about those disparities in your experiences and where you think that might be coming from?
Yeah, I think there's for many years we didn't have a lot of data. So the data that you've quoted there was one of the first sort of really wide-ranging surveys that had been undertaken, community surveys, it has to be said. We've undertaken some other insights since then, which doesn't really contradict that either. You know, we know from our own studies, for example, that gay men are not as active or don't describe themselves as active as heterosexual men. Lesbians are potentially more active than heterosexual women, but not as active as heterosexual men, fundamentally. So we do have lots of stereotypes in the community about about our activity, but I think that that's quite a lot about the way that we are represented within our own community. There's a bit of a thing there about about representation, about who gets airtime, about who gets seen in media, and in reality we are in a situation in the UK still, after, in an environment where we have, for example, equal marriage, we have the Equalities Act, we have protective legislation, pretty good protective legislation in this country compared with other places. And yet one of the things that we know from all our surveys and all our insight is that young people are still having a really bad time in school, and that PE can be a real kind of hotspot for homophobic, transphobic, biphobic, queerphobic bullying, basically. And there's several reasons for that. One, one, teenagers are horrible anyway, per se, although I'll get shot down for saying that, but, having been a parent, teenagers can be really challenging, and, at times when young people are developing their own identities, that can be a really, really vulnerable space. And what you have in school PE still, because school PE hasn't really caught up with society in the same way, is you have really gendered school sport in school PE, where, boys and girls are separated. For young non-binary people, they're forced to make a decision about which group to go with. And those environments tend to be super prescriptive around gender. So for those of us who are LGB and may not be kind of particularly gender normative, those environments can be really difficult. If you think about young gay men coming to terms with their identity, and school PE for boys tends to be a kind of super mask environment, that can be really, really alienating. In the same way, girls in school PE can be really policing of gender in school PE. So I know that from years ago, a study that was done, the perceptions of school PE tended to be that girls who were lesbians would be predators in those environments. You have girls going, oh, I don't feel comfortable in a changing room with a lesbian because she might hit on me. But at the same time, you have this kind of perception that boys will be victims in those environments. And actually, neither of those things is completely true. Those environments can be quite toxic for young people, for young trans people as well now, navigating those environments can be really difficult. We still have no privacy in school changing rooms, or very little privacy. We still know through our own conversations with young trans people are being made to get changed for school PE in like offices, and a young person we spoke to last year, like in a broom cupboard. Those experiences are really, really harsh experiences. So then what we have is young people thinking, oh, forget this. I don't want to be in those kind of environments. That's what sport and physical activity is all about, So you get a big drop off in teenage years. As soon as LGBTIQ plus young people have the opportunity, many of them are making the decision to remove themselves from those environments. And then what happens is, if you're not in those environments, it's really easy to stereotype those environments, to alienate yourself even further. So then what we see is very little kind of sport and physical activity engagement from the age of about 14, 15 through to kind of like, maybe late 20s, early 30s. So those are some of the issues. Sorry, that was a really long answer, but those are
really interesting. And I'm just thinking, so Neil, is any of that surprising to you, and the health disparities and the participation, but also does any of it speak to your experience as a person from the community as well?
A lot of it definitely resonates in terms of my experience and just from my peers' experience of what's happened. So I think, it can't be ignored that there's been a lot of progress as well in terms of accessibility, going away from secondary schools, but even into university, I tried to join into sports, and I remember trying to be part of the rugby team for my medical school, and I remember that was trialing because it was very homophobic at that time. This was 13, 14 years ago. But what I saw through the progression of my time at university was there was an inclusion criteria that was created through the union, basically to try and encourage people to be part of, to be all inclusive and to allow, so we'd have dedicated sort of sports socials to encourage LGBT members of the community and for there to be an awareness being created. So there were things towards World AIDS Day and an awareness of what that meant during sports and things like that. So I saw that really progress within university, but agreeing with the disparity that occurs within the LGBT community, I think there's almost a sort of trying to make up for time kind of situation that the LGBT community are sort of forced into because they have not had any experience or not had much experience at a younger age. And so a lot of gay men, as Louise mentioned, has basically tried to compensate to the point of like overworking and trying to maybe achieve things that they couldn't achieve prior to the time that they were finally being able to find themselves, I guess.
Yeah. Yeah, and I think, I mean, it certainly speaks to my experience. And I, when I was at school, kind of homophobia was a way that the male students and teachers would bond. I mean, it would be a thing that they used between them. And I was like a good runner. I was a sprinter, but I just couldn't. I couldn't fit into that world at all, because outside of that situation, the homophobia would have been directed at me. And so living in those two really distinct worlds just was not sustainable for more than a short time, and it took most of my 20s to pass by before I came back to any kind of like physical wellness at all, actually. And I know that I'm not unusual, and actually in my friendship group I read these statistics and I really see them manifest. I was thinking about on kind of negotiating our attitudes to smoking, and I feel like that's a thing that we can really work on as a community. And I think it was, I've got statistics here somewhere, it was 27.9% of lesbian women and 30.5% of bisexual women identify as smokers, as compared to 18.8% of their straight counterparts. Now that in one moment is really shocking to me, and not at all shocking, because I look at the community around me and I think, oh yeah, I know who those people are. And so these kinds of things manifest in all different ways, because if you've never been encouraged to engage and to look after yourself or to prioritize your body, that things they manifest in different unhealthy ways. I should mention that these statistics and the background for that bit of the conversation is available in a document called Hidden Figures, which is on the LGBT Foundation's website, which you can access and read for free, which is really, really interesting. And it covers all different aspects of, wellness and health from really kind of a diverse point of view as well. So it's a really great document, and we should thank the foundation for that.
I was thinking just in terms of what you were mentioning in terms of especially like the smoking side of things within the LGBT community. I think it's easy to separate the worlds in the past of physical and mental health and well-being, but actually they are very well interlinked. And I think the higher figures within the LGBT community for smoking is usually due to not an unfocus of the mental well-being of side things, and actually improving someone's physical health as well in the form of sports and things like that can actually improve people's mental well-being and therefore reduce other risks, because it all ends up becoming quite cyclical.
And so, I mean, I think more and more people, like you said, are understanding and actually experiencing for themselves that there's a really intimate connection between your physical and your mental health. And I know that that's helped me through a lot of health issues in my life, actually exercise, things like insomnia and anxiety and focus and those kinds of things. And you become a bit of a zealot about it, because if you've never engaged in those things, it's hard to imagine it will do anything for you. But like you say, there's a bigger picture about a holistic approach to the way that we look after ourselves. Do you think that that approach has gained ground from inside the medical profession? Is that something that you experience as a health professional yourself?
Yeah, I think there's a lot of focus on making sure that, you know, that when I'm treating a patient, I have to look at all sides of what the patient might be going through. And so it's, you know, most of the people that come through my A&E, I can treat quite simply, but actually I think there's a lot of, especially in these trying times as well, there's a lot of you know, trying to comfort people's and educate people about what's going on, rather than there might be there might be some underlying issues as well on top that I try and deal with at the same time. So I think, yeah, there's as you said, the holistic view is a really important part of being a doctor these days. And I think that's going to apply, especially with coronavirus going on right now. You know, there's people that will just come in with the flu-like kind of symptoms, but then there will be people that have the comorbidities that exist with them that then might be quite trying on top of that as well.
Mm. So I'm just going to ask kind of a broader question about, I guess, kind of like visibility and its relationship to our health. So Lou, you mentioned that your work involves fighting against kind of various phobias that will allow the community to come into sport as themselves. But also there's a powerful impact that comes from seeing visibly out LGBTQ sports people as well, that really, I think, can motivate the community, and especially younger people. And Neil as well, talking about being a person who is out as a person living with HIV, and especially a person in the medical profession. And a lot of my work is about supporting artists with HIV to see themselves and to see their community. And I think that the visibility is always a conversation in the LGBTQ community, but I think it has a place in conversation about our health as well. Do you think that that's something that we can support and work towards? Either one of you can answer that.
Yeah, well, I think in sport and physical activity, it's absolutely massive. And that's because, you know, people have been really, really invisible for a really long time. You know, you know, and it's a bit of a cliche to say, you know, that you can't be it if you can't see it, but it's absolutely true of our community. You know, on the whole, we're a largely invisible minority. And I think for young people in particular, it's really important to see people ahead of them on the pathway. So that might be, you know, that might be like in elite sport, for example. You know, we all have role models. We all have people that we just think, oh, they're amazing, you know, and you know, and but also just ordinary people, you know, ordinary people coaching, for example. So, you know, LGBTIQ plus people involved in sport and physical activity, you know, working with children and young people. Those kinds of things are really, really important, and you know, and really, really powerful things. Just being out there every single day doing our jobs, you know, we put a lot of emphasis on performance athletes, you know, on people, on famous people, but actually we all have a role to play in making ourselves visible if we feel safe to do that, and in just going about our day-to-day work, and refusing to be silenced and refusing to be made invisible. I think that those things are really, really powerful.
Yeah, that's beautifully put. Thank you. Thanks, Lou. Neil, did you want to say something about visibility? And
sorry, can you remind me that just the
yeah, I was just talking about the
well.
importance of people being visible in different ways in the community. So, as Lou mentioned, working in sports and fitness, just as an out LGBTQ person, might be having an impact that you don't see, that you don't necessarily see straight away, but it's there. And for yourself, you mentioned, you know, being out about your status as a person living with HIV. And do you think about the impact, the importance of that? I think especially for people working in the medical profession, it's really great to see people normalizing living with HIV.
Yeah, I mean, so one of my favorite initiatives that has really increased visibility within the NHS is these rainbow badges and rainbow lanyards that are, you know, it started in a few trusts, but I think it's becoming more and more prevalent across the country. Is basically the idea of LGBT or ally that, you know, if you have something that is medically orientated, but, you know, you feel that is, you know, not being quite covered because of your sexuality or gender, there are people that are, you know, you'll be able to talk to comfortably because they're advocates for it, basically. And it's become a lot more tolerant to be able to talk about it within the medical profession and to the service users as well, which is really, you know, I've seen that develop over my time as a doctor. So I think visibility is a really important thing that is constantly being challenged and improved within the NHS.
That's great. I mean, we did an event last year at the Superbia Weekend in partnership with the foundation, and it was called the Cancer Cabaret. And it was about lesbian and bi women's experiences of cancer care from a kind of a non-cis-het point of view. And there was a lot of comedy and a lot of tragedy in it. But it was really an expression of how all the way up to the point of treatment, your sexual and gender identity can really impact on those experiences for you, being misgendered or being assumed to have a husband when you have a wife, and all kinds of experiences that they brought to that. And I feel like the community has creatively responded to those in really lovely ways, and now the medical profession sounds like it's responding back. So that's really encouraging. So we've not let I keep saying the current pandemic, as if there's going to be another one, let's hope not. But we've not let it dominate our conversation too much, but it's obviously impacting on us in lots of different ways. And I know that, Lou, a lot of your work is obviously about bringing people physically together. And Neil, being part of the Sunday Boys, which is one of the things we spoke about, which is new creative ways for the community to connect by physically being together. Obviously, that's, you know, been something that you're really passionate about. A lot of my work is around events, curating small scale or large scale events for artists and community members to come together. All of this is suddenly and really violently been impacted in the last week. So we do need to talk about the current situation and the coronavirus, how it's impacting on the community. And I mentioned before, social isolation is not a brand new thing for lots of people in the community, but it's a new thing for a lot of us. So can we talk a little bit about how it's impacting on us at the minute? Neil, you mentioned about the impact at work. Lou, what's the impact on your projects and your work like now, and what are your concerns, I guess?
Well, I've just gone through a week where every single LGBTIQ plus sports group we follow on social media has had announcement after announcement that they're cancelling their training or cancelling their sessions. I think some of the good stuff that I've seen out there is that many of the sports groups are moving online to maintain the community, because the really, really important thing about LGBTIQ plus sports groups and physical activity groups is that they provide a community for people. Neil was talking before about mental health and mental well-being, and that is a massive issue for our community. In every single bit of research, mental ill health is overrepresented in our community. And it's important to acknowledge that that is about minority stress. That is about the discrimination that people continue to face in their daily lives, the isolation, some of the isolation that we experience. So LGBTIQ plus sports groups provide vital kind of community spaces for people and opportunities to get to be healthy. Because one of the things about rubbish school sport is that it means that when people get back into sport and physical activity, on the whole, people are getting back into kind of individual sport and physical activity. So in our community, there's a lot of walking to get fit, a lot of running, a lot of swimming on your own, or a lot of gym use. So a lot of things where you don't have to be out, you can be completely invisible, but at the same time, even that physical activity can be quite isolating. The absolute joy of those LGBTIQ plus sports groups is, even if they're individual sports, like for example Pride Out, Manchester's cycling club, where it's an individual sport, but those folks go out on rides together. They're developing a great community. It reduces that social isolation.
Yeah.
So what we want to see, I think, during this time is those communities moving online and us maintaining some of those things about community, about sharing experiences, friendships, checking up on people, making sure everyone's okay, because if somebody turns up for, say, swimming, somewhere like Northern Wave at the training session, and they're looking a bit glum, you can guarantee that people are going to go, oh, you look a bit glum today, you're looking a bit down. Are you okay? How are you doing? And it's about how we maintain those things online. I think those things are particularly important. I know that Neil will have loads of fabulous stuff to say from a kind of medical point of view, but from a community point of view.
But I think that's really nice, is that whatever the project, whatever the activity, you can distill it down to community, and that's the thing that we can sustain. And actually be really proud of the LGBTQI people have been really good at pioneering, actually. And I was just on a video call with a friend of mine yesterday, and we would never normally video call, and we were like, we should do this more often, because it feels like being together. And so I already feel like some positives are just manifesting naturally, which is really lovely. Thanks, Lou. And Neil, did you want to say something fabulous? No pressure.
So I guess in terms of the impact it's had on my work, it's massive. It's completely things are changing on a day-to-day basis. The NHS is working really, really hard to try and keep things up to date and make sure that all of its staff knows what's going on. So we're having pretty much daily meetings prior to starting your shift, to almost given sort of a decision of what's the next policy of how we're treating and what's going to be the next steps forward. You know, so you know, the way that the A&Es are working right now, you know, I'm only speaking from a personal point of view rather than from anything else. They are restructuring the whole A&E. So I guess in this time of difficulty, there's a lot of, you know, there needs to be compassion during this time, because it's going to be hard from both sides, in which we're trying to help everyone as smoothly as possible, but it's going to be rocky as we start to try and figure out what's going on with this. I mean, I've even had to shave my beard for this situation to fit for the masks that fit round for when seeing patients that we are suspecting with the coronavirus. So it's, you know, there's changes across the board that are being put into stake, but then there's camaraderie that's coming out of that. In fact, a lot of my colleagues who were otherwise bearded, we're seeing our colleagues with like finally like freshly shaven faces, and it's very strange to see them without their beards, or they're sporting mustaches and things like that. So people are trying to find levity in, you know, a time of what's, you know, going to be a struggling period of time. And then on top of that, you know, obviously work's not my whole life. I've got the Sunday Boys, my singing group, my family up here in Manchester, and what seems to be growing, and from the examples that you guys have already mentioned, it's the fact that people are banding together and communicating in different ways that we would have otherwise not had. But there's been this flourishing of beautiful like sentiments of supporting those in our community that are probably more vulnerable. So there's people that are immunosuppressed in our community for certain due to certain conditions, or there are some that are, you know, the age range from my choir is from about 25 to 65 plus, and so we've got this whole age range of gay men who are needing support at this time. And so it's beautiful to see them, that there's people willing to, you know, drop off supplies if people are struggling to find it, or if they're socially isolated, just to create these small little groups on online as well, just to video talk. And you know, there's ways of trying to continue our services in a way that we wouldn't have tried before, such as trying to do online singing as a group together. It's not as effective as a real live rehearsal, but I think the element of social connectivity that can still be brought by that will, you know, is still important, and still
and it can sustain us while we need it. That's the key thing.
Definitely.
Those were both really positive sentiments that you both brought there, so I'm gonna end there, because positivity is what we need. And I just want to say thank you both for giving us your time, and I appreciate, and the community appreciates, the work that you both do, and I wish you health first and foremost. We're going to make some time at the end of this broadcast for audience questions, but we just want to thank Lou and Neil for their time, and to Manchester Pride for hosting this conversation and this conference today. And thank you all for watching and listening. It means a great deal to us. Thank you so much.